Good morning. This is M.L. Curry with my 15 minutes on workers' compensation and personal injury. As usual, we come to you by way of the website as well as through the radio station itself. Those of you who are following this program on the website, you're following at www.attymlcurry.net. You can also follow this program on Facebook, YouTube, and Twitter. Those three you will follow at ATTYML. Today's program is sponsored by Total Healthcare Management. Their offices are at 12,000 Richmond, that's their central office. They also have an office at East Tidwell and Airline, that'll be 45 North, and then 45 South is at College and Airport. The fourth location is at Chimney Rock in West Belford. Their number where you can reach them at all of those locations is 713-522-6911. One of our other sponsors, where I am today, is at Memorial MRI and Diagnostics. Their number is 713-461-3399, and they're at 1241 Campbell Road, which is where this program is being aired from. To my immediate left is Dr. David Dent, and he's going to be our guest today. And I wanted you to introduce yourself and just take a few minutes and tell the audience about what you do and where you come from.
Sure. I'm Dr. David Dent. I'm a pain management physician, board certified. Been in Houston for now my 7th year. I've been in practice since 2005 in Texas. And I've been at Memorial MRI and Diagnostic since 2006, doing a host of pain management procedures, and also seeing patients and diagnosing problems.
Now, when you say pain management procedures, what does that entail primarily?
Sure. It usually entails putting a needle somewhere inside the body, whether that be into a joint, into the epidural space, or into a deep facet joint, or placing spinal cord stimulator trial leads into the epidural space near the spinal cord.
Now, is pain management usually done before or after surgery? Which do you find gives you the most benefit?
Well, it depends on which aspect of pain management we're talking about. A lot of the steroid injections work better before surgery, and after surgery, some of the steroid injections work, but you're more focused on other things such as radiofrequency ablation or spinal cord stimulation after surgery if the pain continues.
Sometimes I've read some of your reports, and they indicate that you have recommended and do perform epidural steroid injections, and this is primarily for back injuries or neck injuries, although it is done for other areas of the body. Most often I see it in regard to back injuries and neck injuries. And what has been the change recently in regard to how many ESIs they used to do and how many they do now as a prelude to surgery?
Sure. It used to be that you'd kind of shotgun 3 at a time and do the epidural steroid injections and but not reevaluate the patient. Your current standards are to do one injection, reevaluate the patient, see if they're benefiting from that, and then determine if you need to proceed forward with a second injection, and then do the same thing after the second. And the third is kind of plus or minus whether you're going to do the third or not.
Yeah, I remember back in the past, 5, 6, 7 years ago, it was almost automatic that 3 were going to be done, and then the evaluations. What Dr. Dent is saying now is that 1 injection is done, and there's an evaluation, and then the second is done, and then there's an evaluation. So you have some situations where a person does just 1 injection, and then there's a determination made based upon just that 1 injection as to whether or not they're a surgical candidate.
That's correct.
What are some of the things that you're looking for in regard to the pre-injection and post-injection symptoms that will help you to determine whether or not to do the second injection?
Sure. With the epidural steroid injections, you're looking for radicular type signs and symptoms.
And for those who are not familiar with radicular symptoms, those are what?
Sure. This could be pain running down the legs or the arms from the back of the neck. This could be numbness in the arms or legs. This could be also weakness in the arms or legs. And that could identify or let you know that this may be an injury to the spinal nerves, and then something needs to be done about it before it progresses.
And in some situations, this injury to the spinal nerves is in conjunction with a disc problem.
That's correct. Oftentimes, that the nerve injury is from a disc, whether it be direct compression onto the nerve or a chemical irritation from the disc onto the nerve.
And since we are at the facilities of Memorial MRI, talk to the audience a little bit about how the MRI itself is used in conjunction with the epidural steroid injections, meaning that the MRI may be done before or it may be done after, and how is it beneficial to you as a tool?
Sure. Well, MRI is usually going to be done before the procedure is done. This will help you kind of corroborate the signs and symptoms with actual images of the disc, of the bones, of the nerves, and with MRI, as opposed to X-ray, with MRI you can see what we call soft tissue, and that's the structures such as the disc and the nerves, and you can see what the pathology is down deep in the back of the neck.
I noticed on your CV that you spent time at the University of Illinois in Chicago, and that was for your graduate school, is that right?
Postgraduate school and a residency.
Okay. It just so happens that myself and my wife are from Illinois and went to your alma mater, the University of Illinois. Well, we went to Champaign-Urbana, and you were in Chicago. She's born in Chicago. Part of what we do in regard to this particular program is we attempt to inform the individuals who are listening and who are watching. Some individuals who are listening to the program on the radio, it may be better for you to access the website. But what we try to do is we try to reach out to individuals who may not be listening to the program, and those people are the friends of individuals who have been injured on the job or injured in a motor vehicle accident. Sometimes you may see that your neighbor is struggling, either limping or just not being able to do the normal things like mow the lawn and that kind of thing. So we encourage individuals like yourself to approach your neighbor or your friend. Co-workers sometimes get injured, and a lot of times they're in denial about their accident, and we find that the sooner that the person starts to get some help, and that help may be encouraging that individual to talk with their doctor about getting diagnostic tests done. I'm sure that in your practice frequently you see individuals who come to you after 3 or 4 months of care and they've not had any diagnostic testing done. So sometimes this situation is one where an individual other than the injured worker may be the person who will have to step forward and ask that person how their treatment is going. So when you watch a program like this, you come to understand that from the time that the person has been injured to the time that some diagnostic testing needs to be done, depending on the injury itself, this can and should be done sometimes as early as 1 month from the day of the accident, and sometimes as early as 2 or 3 weeks, depending on the severity of the accident. Some of the things that you do as far as injured workers are concerned, I just wanted you to talk a little bit about a brand new patient just walking through the door and the type of evaluation that you have to do for that individual.
Sure, and I think it's extremely important to do a very thorough history of with the patient, whether it be an injury or not, and also about what their background is. Really take the entire view of the patient, and then do a very detailed physical exam to try to help you identify any pain generators that may be present. And I think it's important at that time to try to make the best diagnosis possible so that you can dictate the best treatment possible. And that's where I think that's where it's just extremely important to take the time to make the right diagnosis.
A lot of times we have to forward records to your office or over here to Memorial MRI in regard to past problems that a person may have. And a lot of times when we have our clients, patients to come in, they are concentrating strictly on what has occurred right at this particular incident. And what Dr. Dent is saying is that the past medical history that a person may have is as relevant as the current history. So if you've been involved in an accident or had an injury or something like that before this particular accident or injury, and it involves the same member of the body, it would be a good idea for you to have your medical records from your previous incident or accident so that those records can be coordinated with the ones that are relevant to this particular accident. We have situations where sometimes a person has multiple injuries, and what Dr. Dent is saying is it's important for you, the patient, to give the provider a thorough history. Sometimes people gloss over what has occurred, and they're not as detailed as they really need to be in regard to the mechanics of the accident. What exactly you were doing, how did the accident occur, what you felt, what your symptoms were before you even get to the medical provider so that you can have that examination. And it's very important for me, if I'm going to be representing you, that you get a good, accurate history, give a good, accurate history to the provider so that that becomes part of your record. You'd be surprised how many times a person comes to my office and they're saying that they've got 3 injuries, and then I look at the records and there's only 1 injury that has gotten any kind of attention. So then we have to kind of go back to the drawing board and make sure that the individual has the proper care as well as gives a good history so that Dr. Dent will know what it is he's treating. Just briefly, what's the biggest difference that you find in treating patients who are in a network as opposed to patients who are not in a network?
Well, we try to treat everyone the same. You have a certain set of guidelines called the Official Disability Guidelines here in Texas, and
ODG.
ODG.
Yes.
We pretty much just follow those guidelines, and they are guidelines. It's not a cookbook, but and we do that with all patients, whether it be network or non-network.
Okay. We find that the providers try their absolute best to provide the best care that they can for an individual, but the system sometimes requires that a person whose claim is considered in network, they're restricted to the doctors who are in that particular network, and other individuals are able to choose doctors in or outside of a network. You're able to choose any doctor that you want, and I find it a extreme comfort when I look at a patient's list that their insurance company sends to them, and I find Dr. Dent's name there. Since the patient does have the absolute right to make one free choice of doctors, and make sure that when you're doing that, that you choose a doctor like Dr. Dent, who's going to make sure that he examines you thoroughly and gives a clear and accurate diagnosis of all of your injuries. It is a real comfort to be able to not have to change doctors, but sometimes you do. So individuals whose claims are out of network, you have to fill out a 53 and get it approved through the commission. But if your claim is in network, you will only need to get permission after that first free choice. So make sure that that first choice is an informed choice, which you probably want to make with the assistance of someone at Total Healthcare Management or here at Memorial MRI. Some of the other individuals may contact my office through our other sponsor, which is IWP, Injured Workers Pharmacy. Their number is 281-753-6770. So it really doesn't matter which direction that you're going in, as long as you get to the right place, which is to my office at 222-2400. I'd like to take this time to thank all of you for listening today and hope that you tune in next time.